Hi, everyone. As people are still trickling in, we'll be beginning quite shortly. We'll allow some people who are still connecting to get here, but welcome. Um, it'll be nice to know where people are joining us from. So if you can use our chat feature to let us know where you're joining us from, that would be fantastic. I see a lot of people joining from all over the place. Um, Zambia, Nigeria, Kenya, the United States, Eswatini, South Africa, Uganda. And if I haven't mentioned your country and you mentioned it um, in the comments, feel free to interact with us. And yeah, I see a lot more countries now: Malawi, Netherlands. So as people are introducing themselves, I think we should just go ahead and start, and hopefully more people will join us as we go. So welcome to our SKILLZ No Means No Sexual Violence Prevention for Boys and Young Men webinar. I'm going to ask Molly to change to the next slide. So today we are going to take you through a collaborative journey of No Means No Worldwide, Grassroot Soccer, and Bantwana Zimbabwe, and how we established an innovative strategy for male engagement in sexual violence prevention. And just a little bit of housekeeping. Please use the question and answer function I think, at the bottom of your screens to ask us any questions as we go. We'll answer as many questions as we can at the end of this presentation. And we also encourage you to use the chat feature as we go. Next slide, please. Just before I introduce myself and my speakers, my co-presenters introduce themselves as well, I just want to acknowledge that we were supposed to be joined by Banile from Bantwana Zimbabwe, but due to personal reasons, she couldn't be here. So we have Bonisi Chuma from Bantwana Zimbabwe as well, who is replacing her. And my name is Craig Dube. I'm a lead trainer for No Means No. I am based in the Netherlands, and our organization is an international non-governmental organization whose mission is to end sexual and gender-based violence against women and children globally. And we train instructors in high-risk environments to deliver evidence-based sexual violence prevention curriculums for girls and also for boys. And we'll go into detail about the boys program today. So I'm going to pass it over to Bonisi to introduce himself.
Thanks, Craig, and welcome everyone. My name is Mbonisi Chuma. I'm the executive director for Bantwana Zimbabwe, based in Harare in Zimbabwe, where we have our sort of HQ. Bantwana Zimbabwe pretty much is a social protection partner. We do both direct implementation and sub-granting. Our main areas of focus, so Bantwana means children. So we do support children and young people with health, child protection, education, and social protection interventions. God knows.
Okay, thanks, Mbonisi. Thanks, Craig. Good afternoon, good morning, everyone, wherever you are. My name is Godknows Ngwenya from Grassroot Soccer, working under the Global Monitoring and Evaluation Department. So Grassroot Soccer is an adolescent health organization that leverages the power of soccer to equip young people with life-saving information, services, and mentorship they need to live their lives. So it's good to have you here as we are going to discuss more about the boys program. Thank you. Over to you, Craig.
Thank you, Godknows. We are also joined by Molly. She's in the background, so I might be interacting with her by saying next slide. She's our communications specialist at No Means No. Next slide, please, Molly. So the reason why we are here today is to talk about sexual violence. So sexual violence is a widespread issue that exists in virtually all cultural and socioeconomic contexts. And throughout the world, boys and men are largely the perpetrators of sexual violence, and girls and women are predominantly the survivors or targeted. And as a result, male identity and masculine norms are undeniably linked with violence. However, significant research shows being biologically male is not the key cause of men's violence. Rather, boys and men are often raised, socialized, traumatized into, and or encouraged to be violent. And this depends on their social surroundings and life conditions. It is increasingly understood that men's use of violence is generally a learned behavior, that they are not born to be violent. So until recently, most of the sexual violence prevention work that we've seen have mostly focused on girls and young women only. But we believe that this is not enough. So like many of you here today, No Means No Worldwide believes that sexual violence is not just a women's issue. We believe that boys and young men must be actively involved in the solution. And research is showing us that the key to interrupting the cycle of violence is to intervene and reach boys and young men when their attitudes and beliefs about gender stereotyping and sexuality are still developing. Next slide. So for what we are here to talk about for the SKILLZ No Means No program, this is a combination of two evidence-based adolescent health programs, the SKILLZ Boy program, which is a project by Grassroot Soccer, and the No Means No Boys and Young Men. And it was implemented by Bantwana Zimbabwe in Zimbabwe, and we'll talk about that a little bit more. And for us, as No Means No, our approach to sexual violence was conceptualized in 2009 in Kenya. And since 2018, we have accelerated our reach to partners across sub-Saharan Africa and America. And we've continued to grow. As we continue to grow, we are seeking innovative ways to make the No Means No intervention more interactive for boys. And informed by our good results and evidence from our existing approach, we still wanted to make it more fun, more engaging, and more contextualized. So we introduced our approach to Zimbabwe, And as we did that, it was imperative that we collaborate with leaders in this space who have knowledge of the context of the country better than we do, hence our partnership with GRS and Bantwana. Over to you, God knows. You're on mute, God knows.
Okay, thanks, Craig. So the curriculum is a collection of 12 sport-based education sessions for boys with the aim of preventing sexual violence. So No Means No already yet an effective, well-known evidence-based program for preventing sexual violence. But now we wanted to enhance it with a sport-based approach that is a proven track record in Zimbabwe, as well as global, in order to meet adolescent boys, young men where they are. So it is in this case that Grassroot Soccer has been implementing the sports-based interventions since 2002 in Zimbabwe. So the SKILLZ approach, this is SKILLZ is a Grassroot Soccer sport-based approach to improving various adolescent health outcomes. So SKILLZ utilizes a 3Cs model. So that is the curriculum, the coach, and culture. So the curriculum is evidence-based, as well as it's also age-appropriate. And in the curriculum, you find like metaphors, football metaphors, soccer metaphors. And this curriculum is delivered by coaches, near peer mentors, and comes alive through a praise-based culture, where the coaches create a safe space for young people to talk about the issues in their lives. So as you well know, all of us here, soccer is the world's most universal sport and popular sport. So we use soccer as a hook and platform to reach adolescent boys and young men. If you can travel over the world here, you will realize that when you go into the streets and elsewhere, you find boys playing soccer. And soccer is very easy to play. Like, you look at the equipment that we use for soccer. It doesn't need sophisticated equipment whatsoever. Whatever that you have at your disposal, you can use it, whether bricks for goal posts, rec balls, and then you play. And you can see the joy that is there amongst the players and even the spectators worldwide. Yeah, thank you. Over to Greg.
I'll ask Bonisi also to talk a little bit about Bantwana Zimbabwe.
Yeah. So thanks, Godnose and Craig. So after this curriculum was developed, which brought in the sexual violence prevention piece and the interactive soccer component, it then needed a community platform for it to be rolled out, and Bantwana Zimbabwe provided that. We at the time that we started, we're implementing a DREAMS program funded by the CDC in 4 districts, but for this program it was implemented in 2 out of those 4. And for some of you who are familiar with the DREAMS program, it targets adolescent girls and young women, but there are no direct interventions for boys. So in this program, you have HIV, GBV, and sexual violence prevention curricula, which is targeted at girls. And in our platforms, we always had these issues of why are you excluding boys? Why is there why isn't there something targeted at boys? Yet boys grow up to be the perpetrators of violence, and they are also violated, and there's very little reporting. So this program was a perfect integration with what we were already doing in the communities, targeting the boys and complementing efforts that we were already doing in the ground. Next slide, Molly.
All right, so what you see on your screen at the moment, this is the overview of the knowledge and skills that young boys who go through our 12-hour program come come out with. So the program involves introducing key skills, not only theoretically, but allows the boys to learn practically through real life scenarios, through storytelling, and they get to practice the skills through role plays. And as Godnos mentioned earlier, they also learn from the soccer-based metaphors that are embedded within the curriculum. So I'm going to ask Godnos to just paint us a picture of what does that look like? What does a soccer-based metaphor that delivers some of these knowledge and skills look like?
Okay, thanks, Craig. So within each practice, there is a specific structure. So the practice is structured. First, we have got the topic that is introduced, and then there is a sport-based activity after introducing the topic, and then there is a discussion, and then there is reflection sharing after that. So the sport-based activity and discussion thereafter creates a safe space for a discovery-based learning approach. So in this moment, knowledge is retained, empathy is built, and reconversations are made. So I'll give an example with one of the sessions that we have in the SKILLZ No Means No curriculum. So session number 3, called Gender Box. So in this session, participants discuss limitations due to gender expectations, how gender expectations and norms impact them. So participants also discuss how they can support each other to create new norms around what it means to be a man, how gender roles and power imbalances also lead to violence and negative personal outcomes. Afterwards, the instructor or coach leads a discussion and emphasizes his own personal story and experiences, thereby creating a safe space for the participants to do so as well. So I think in a nutshell, this is how the practices are structured. Thanks, Craig.
All right. So when it comes to how we designed it, we collaborated with Grassroot Soccer initially in February of 2022. And we workshopped some of these ideas where the workshop was key to ensure that we have a collaborative co-design approach, where we have a better understanding of, the complementary approaches that we had. So we field tested some of these activities. So we co-created it with boys that were of the same age, pretty much, as the participants of the program, and got to hear some feedback of what they would love to hear, what they would love to talk about, and how they feel about the soccer-based activities that we were proposing. So we did learn a lot how to work with each other and also how to work with young people in Zimbabwe. And through that workshop, we also got to realize that drug and alcohol use, along with teenage sexual behaviors and mental health, were a major concern for the Zimbabwean government and for the teens as well. So we felt that it was important to include these sessions, even though it meant that intervention would be a little bit longer than what we both were used to do respectively in our organizations. So we extended the intervention to have 12 sessions. So the first 10 sessions would be on what I just showed in the slide before this one. And then the other 2 would be on sexual violence, on sexual reproductive health and rights and HIV, as well as talking about drugs and alcohol use. So that's in a nutshell how we came up with this design. And then God knows, how did we then do the training of trainers?
Okay, thanks, Craig. So after the design and the Skills No Means No curriculum, so now the training was done. 32 male instructors from Bantwana Zimbabwe were trained, and after a year of implementation, 8 out of those 32 instructors were also trained as trainers. So instructors are the young men who are trained to deliver the program, the Skills No Means No program. So they were recruited by Bantwana Zimbabwe, and there's a certain criteria of recruitment that they went through. So it included someone who is a good facilitator, basic education, that is 5 ordinary levels here in Zimbabwe. And that person also passionate about making a change in their communities. So, and then the trainers, as I mentioned, they were pulled out from the 32 instructors that were trained. So the trainers now, they assist in conducting trainings of instructors. They also assist instructors when they're delivering their programs when the program implementation is being done. And they also assist the lead trainers during trainings. So these instructors are young men aged between 18 to 28 years, and they are role models in their communities. Somehow they might have observed many forms of violence being perpetrated by either them, their own peers, or other community members, and decided to take a stand. So they decided to take a stand and work under this program so that they become agents of change and stand up to promote gender equitable norms in the community, empower every young adolescent boy to easily identify harmful norms, and prevent violence in their communities. So they showed interest in joining the movement as partners and allies of girls and young men in promoting gender equitable norms. So during the training, it was an exciting and very interesting training. So there was open space where they had conversations around health, social norms, and so many. They also had time to discuss how they could be allies in changing some of the social norms. They were also able to identify how their own attitudes and behaviors perpetuate some forms of violence against women, and also to come up with strategies of how they could address this. So in a nutshell, this is how the training was like, and this is how these guys were given knowledge to go and implement the Skills No Means No curriculum. Thanks, Craig, over to you.
All right, thank you, God knows. So after that training, then we go into the implementation phase. So I'm going to ask Bonisi to talk us through how we then implemented the program and what were some of our initial findings with that. So over to you, Bonisi.
Yeah. So as we said at the beginning, the program was then rolled out in 2 districts, in Matabeleland North, in the Matabeleland North region of Zimbabwe, and those districts are Nkai and Cholocho. And those particular districts were chosen because of relatively high HIV and GBV prevalence. But also within those districts, we then selected schools, high volume schools, schools in areas where there's also high HIV prevalence, high HIV and GBV prevalence that were also supported by under Dreams. And we, as God knows mentioned, we also supported, helped in the selection of the instructors who received the training, and then we continued to support them. We conducted, so over and above the training, we will then have, after every 3 months, debrief sessions with the instructors, sort of like review their work in the communities, troubleshoot on challenges entry into schools, entry into wards, stakeholder management, things like M&E support, curriculum review, and their own welfare issues. And in some cases, when they deal with these issues, they also have to reflect on how the program is impacting them. And we had those conversations with them in the debrief sessions. In December, we carried out a rapid assessment, which sought to sort of like assess how the program is going. Is the methodology effective? Is the methodology accepted? Is it achieving the preliminary outputs or outcomes? And part of those results are what we're going to share today. In total, we reached about 8,600 adolescent boys and young men aged between the age of 9 to 17 between last year, September, and this year, October. And I'm going to share some of our preliminary findings from implementing this program. Next slide, Molly. So from our evaluation, as I said, we wanted to assess the relevance, the feasibility, and the effectiveness of this curricula and approach. And we analyzed data from the 8,600. We managed to analyze data from 1,623 adolescent boys and young men. We interviewed them. There were focus group discussions, and there were also key informant interviews, as well as pre and post test for every training that was done. We found this to be very effective. Overall, it was an effective intervention in ensuring that there's increased knowledge levels, increased attitude, positive attitudes towards issues of HIV, STI prevention, substance abuse, mental health, as well as sexual violence prevention. There were as God knows says, soccer is a unifying sport. So we find that there was a lot of engagement from the adolescent boys and young men. There was a lot of fun, and the edutainment ensured that we retained 100% of all our project participants from start to end, which was quite impressive on our part. It was quite an impressive outcome from this project, and that could actually be attributed to the methodology of the delivery. Next slide. From the pre and post test, just sampling part of our results. From the pre and post test, you can see that there was a huge improvement. There were huge improvements in terms of knowledge and attitude of the young men before and after they underwent the curriculum. You can see that for the knowledge, there was more than double improvement in the knowledge that they had, and then for the attitudes also, we had an 85% improvement in that score. Just to pick up one or two topics where the boys struggled and where they did well in the pre and post questionnaires, we would ask them. It was like a set of questions that are administered before they are trained, and then afterwards. So there were questions like, boys and men do not need to go, boys and men do not need to go to others for help. Boys and men should not show emotions like care, love, weakness, fear, or sadness. Generally, even though there were improvements, we found that the scores in the pre and post were relatively low amongst adolescent boys and young men, which shows that there's still a lot of work that needs to be done in terms of gender norms change, and how men view masculinity. And then where they generally did quite well in the pre and the post were questions like, which approaches can you use for effective and safe bystander intervention. Like if you're observing something and you want to intervene, they generally did well in those questions. And then next slide, Molly. For some of the qualitative issues that we saw coming out, we had 5 cases of self-disclosures, of self-reporting of sexual violence that had occurred amongst adolescent boys and young men. One of those cases, off the top of my head, was a 12-year-old who was being sexually abused by a maid at home, and had now picked up an STI, and for the past 2 years had been quiet about it. But as they were going through this curriculum, then realized that this behavior was not normal, reported it, and the case was taken up by the law and handled accordingly. Some of the quotes that we got from the field, as you can see in the screen, the first quote was from an instructor. And he says, the boys are now coming to tell us if anyone amongst them violates a girl, like pulling up her uniform or touching her private parts on their way home after school. They make sure they tell us on the next session. If they can, if they can get people at home who can buttress more on that, it will definitely stick in. The grade 7s asked for my number. This was an instructor, for my phone number after our sessions, to show that they want to report and always keep in touch. I think it's something they will grow up with. And then the other quote on the screen was from a young participant, a youth participant from Cholocho. He says, I used to disrespect girls, but now I treat them equally, and it is my responsibility to protect them. Like, even if we are walking in a place which has privacy, I'm not supposed to touch them. So these are testament of the impact of the program. So whilst the curriculum builds the agency of boys to protect girls within their communities, it also sensitizes them on what is right and what is not wrong, and what is wrong, and gives them the confidence to come out and report instances of sexual violence. Next slide, Molly. So I'll hand this one over to Craig.
All right. All right. So I think this is a good point for us to stop and go to our audience and see what kind of questions they have. And meanwhile, Molly will drop some comments, I think, in the chat box at the end, some of these contact details that we have. But we'll invite Molly to come and join us so that she moderates the question and answer section. So over to you, Molly.
Thanks, Craig. And unfortunately, I think we may have lost God knows internet connection. So I know there were a few questions that maybe were tailored towards him, but I will make sure we collect them and we can follow up on that. We have a lot of questions, so I'm just going to get to a few of them today. If anyone on the webinar, if I don't get to your question, please feel free to use that to reach out to us. You can use that partnerships@nmnw.org email address, and we'll make sure that whether the question is directed to any of the speakers, we'll make sure that they get that and we respond to that. Okay, so we did have a question about how do you keep the boys interested to attend all the 12 modules and mobilize them to engage engaged? Munisi, do you want to take this one?
Sure. So number one, it was in the selection of the trainers, the instructors. The instructors, this curriculum needs very good instructors, people who are engaged themselves, who are very enthusiastic, and who connect with the boys. Number two is what God knows said, soccer. If you watch them in the field playing and going through the drills, it's like a proper practice session, a proper soccer session. So it's almost like it's almost like these boys are actually training for a match or for a tournament, but the drills are related to a certain message, and here and there they pause and they reflect. And then, of course, there were very small, minimal refreshments, but I wouldn't say that was a major issue. Water, things like that, that will be part of the sessions. The number one thing, really, I would say, it was in the blending of a sport that they're interested in with a very important subject matter which relates to them, delivered by an enthusiastic lot of facilitators.
Yeah.
Great, thank you. And God knows, thanks for, we're glad you were able to get back on. We did have a question about the integration of soccer with the curriculum. So there was a question about whether we have a program like I'm going to combine two questions. One is if this program has a version for young men, so slightly older groups, maybe 20 to 24. And the second part of that question is, would that still use the same approach of combining it with soccer-based activities? So this might be sort of a co-question for God knows and Craig. So maybe God knows we'll start with you.
Okay, thanks, Molly. I'll speak much on the first part of the question on the integration of soccer curriculum and culture. So like I said before in the previous slide, that the skills approach, so we use the 3Cs model. So the 3Cs model, that is the curriculum, which is evidence-based and age-appropriate. And then we've got the coaches who are the ones that deliver this curriculum. And then we've got the culture that is alive, the culture of praise, culture of fun, that really make these boys like to be part of the program. So now, what is the connection between the curriculum and soccer? So the curriculum uses soccer metaphors in the activities. So these soccer metaphors are the ones that make it easy for the adolescent boys and young men to understand even the most critical questions that might be mostly critical sessions or topics that we'll be discussing. Like for example, sensitive topics like gender issues and stuff. So with the use of soccer metaphors, as per example that we gave on that activity, on that session gender box, it makes it easy for them. So it breaks it down and make it look more easier for them to understand and also to relate with whatever that is being taught. Thanks, Molly.
Yeah, and then on the aspect of whether this curriculum can be used with, or if there's one that exists for use with older men, this particular curriculum has just completed its pilot phase. So we conceptualized it in 2022, and Bantwana had been rolling it out since 2022 and the greater part of 2023. And we specifically designed it for use with adolescent boys. With that being said, we are always looking for innovative ways of engaging men in sexual violence prevention, and I believe we'd be quite open to explore options where we could look into using this same curriculum with young men, even though we currently do not have. So I think it would look slightly different because, as you know, the needs of young adolescents are quite different from the needs of young men. Even adolescents that are maybe 9 and 14, their needs are different from adolescents that are slightly older, and their needs are also different from adolescents that have already completed high school and going further with their life. But yeah, I think it would be quite interesting to see what are some of the ways that we can engage more members of the community, because we believe that our program works, and it does need some holistic approach where we can also reach out to community members, because sometimes some of these kids that go through our programs, they will always say, I wish I could, have my dad listen to what you guys are saying, because some of the negative social norms that they get, it comes from the community. It comes from older men. They're emulating men that are already in their communities, and would love to see more and more programming that is not just directed at boys, but also directed at older men. Yeah. Thank you, Molly.
Thanks, Craig, and thanks, God knows. I did want to recognize that we are at time, but we have so many questions so if participants would like to stay on, we can answer a couple more questions. If there are people who have to drop off, just know that we are going to share the recording as well as the slides from this presentation. And I'm sorry if we're not getting to everyone's questions, but we are going to take them in and take in the points that were brought in the chat. Mbonisi, there was a question for you that I think is really relevant here. The question is, how does Bantwana Zimbabwe actively engage and involve families and communities in this initiative, recognizing their influential role in shaping the tendencies of young people, especially boys? So in other words, boys go to the program, then they go home, or they go out into the community, and kind of what is the organizational approach to that?
Thanks, Molly, for that. That's an important question. So firstly, just before I answer that question, just to say that we are going to be presenting this at the ICASA conference that is happening in Harare first week of December, and we'll share a lot of these stats on how to engage the family. So initially, when we started this program, the curriculum was specifically targeted at boys, but it was layered onto the Dreams intervention, which has got an HIV prevention curricula, some social protection activities like education support, economic strengthening, and then the third tier would be engaging the communities in gender norms change pieces. So where we go out and actually have community meetings disaggregated by different types of demographies, like men's forums, churches, and so forth. But specifically connected to this curriculum, we started having focus group discussions at community level to identify how we could influence positive masculinity in the communities. So these focus group discussions were with various stakeholders who are not necessarily who can be part of the program but are not necessarily part of the program. So family members, older men, including some women, just to try and understand the gender issues and try and fit back into the curriculum as well. So I hope I answered that.
Yes, I definitely think you did. Gosh, there's so many good questions here. So how about this? We're gonna, I want to end with a last question, which is for each of you. So if you could each take maybe a minute to answer. What do you think made this collaboration a success?
This is for all of us. So Molly, from my end, what I can say is Bantwana had been working with No Means No, particularly on the sexual violence prevention curriculum for adolescent girls and young women for years. And we were also working with Grassroot Soccer for a couple of years. So this collaboration did not come in as it came into partners that already had a relationship. It was bringing together partners that had been talking together. So it was not difficult to start up the intervention and to continue the work that we were doing together. That would be my point.
Okay, thanks, Mbonise. So what I can say that made this collaboration more easier and successful is that for us, Grassroot Soccer has been working in Zimbabwe since 2002, and it brought a lot of experience in this collaboration, and also bringing an approach that is fitting much into the same approach that No Means No has, where No Means No had already had the curriculum that was addressing adolescent boys and young men, same as Grassroot Soccer as well get the same. And also Bantwana, we've been working with them, like Mbonisi said, so it made it more easier and made the collaboration so fun, is witnessed by the results that have also been presented here. Yeah, that's my submission. Thanks, Molly.
Thank you, Molly. I think God knows and Bonisi really cover a lot of what I wanted to say, but I think one of the key things that make this intervention successful, and probably our other interventions independently successful, is that contextualization aspect of our programs, that we do not have a one blanket fits all approach when it comes to interventions. We take the needs of the communities that we're going to work into consideration. We try to make our curriculum culturally sensitive and as accessible as possible. I've been trying to answer some questions as well in the background because I think accessibility is one of those issues that people can ask about when it comes to, you know, doing things like soccer. But I would say we are always open to innovate, to collaborate with other organizations or other people that have innovative ideas on how do we make our curriculum more culturally sensitive, more accessible, especially to people living with physical and mental disabilities, for example. And we always take that into consideration when we do our program. So in this case, we saw it fit that for Kai and Cholocho, we could do a soccer-based activity. And maybe in some other parts of the world, we could tailor it a little bit differently based on those needs of the communities that we going into. So yeah, I think that's my answer for that. So thank you.
Thank you, Craig. And thank you, everyone, for attending today. We really appreciate everyone's participation, the lively questions, the lively chat. Thank you to our panelists, and thank you for your interest in this topic. Again, if you have further questions, you can either reach out individually to the organizations, individuals on this panel, or send a note to partnerships@nmnw.org, and we'll make sure those questions get distributed. We'll circle back and see if we have capacity to perhaps have a follow-on discussion about this project, because it seems like there was a lot of unanswered questions, but folks have a lot of interest. So thank you again, and we really appreciate your participation, and we will be sending out the recording and the presentation by the end of this week. Thanks, everyone.
Thank you, everyone. Take care.
Thank you, everyone.